Hello and welcome to episode 16 of our live series designed to help you take a step towards parenthood. If you've been following us, you know that in the past few weeks we've connected you with some of the best doctors who specialize in fertility and IVF across the country. And today we're going to be talking about a topic that we cannot stress enough on. Today we're discussing if you've had a failed IVF cycle, if you've had a failed IVF try, what you should do next. And in conversation with us, we have Dr. J. Mehta. He's an infertility specialist, a gynecologist, a laparoscopic surgeon, and founder and director of Shri IVF Center in Mumbai. Thank you, Dr. Mehta, for joining us today.
Thank you so much. Thank you. Thank you for having me over. It's always a pleasure to join you guys. Thank you so much.
Sir, before any couple, decides to even undergo IVF, what are the few things they should know without fail?
Right. See, one of the most important things which a couple should know, the word couple is important, in that when you are looking at fertility is a problem of the couple. Fertility is not just the problem of the lady or just of the male partner or something like that. It is a problem of the couple. So whenever you are trying to evaluate, whenever you are trying to treat, whenever you are trying to, justify a treatment, it should always be oriented to that particular couple. And I think that is, if there is one take home point, then that is that. Because if we look at our country very broadly, usually, fertility treatments are always burdened over the women, and the focus on male partners is not optimal, or rather I would say suboptimal, right? And because it is suboptimal, remember, we all know this, we've all studied this in school and on National Geographic and on Discovery Channel, that in order to have an offspring, in order to have a child, 50% contribution comes from the male and 50% contribution comes from the female partner, right? So why is it that the female partner is given 100% of the attention and the remaining 50%, the male partner is given 5% of the attention, right? And if that is addressed nicely, then I think fertility issues across the country would be handled way much better than what they are currently being handled.
So I think you're absolutely right in pointing out that, it's the onus mostly is on women, very rarely on men. For that matter, in all the sessions that we've had, a lot of doctors have pointed out how initially it used to be just women who used to come in and were their husbands. But do you think that's something that, in your practice, you've seen changing, that now men are also part of the conversation? They also come to clinics?
To be honest with you, Meghna, if I may call you Meghna directly, to be very honest with you, Meghna, in IVF, when we look at IVF has a lot of subspecializations, right? And we happen to specialize in something called as azoospermia. That means when males have 0 sperm counts. Okay, so we get patients for that from across the country and across Asia. So what happens is, fortunately, we deal with lots and lots of male patients, right? To have a look at that, and you will realize that even in them, it's the female who is always overtreated. So imagine for a couple where male needs 90% of the treatment, the wife is treated, right? But the male is not probably treated. So imagine what would be happening to those normal IVF couples where they are facing something called as a female factor fertility. That means the male is normal, but the female is predominantly infertile. You can just imagine what would be happening in those type of situations. So, but yes, I think it's changing. I think it's changing. I personally believe. I'm not a very I'm well known, but I'm not very old. So what happens is I end up seeing most of the patients of my generation, of my age group, of between 35 and 42 is the patients who are predominantly opting for treatments, and they end up becoming very close to me because of the very limited age gap which we have, right? And because of that, I think people do like to open up. I also believe that when you speak to the male partner alone, right? When we normally talk of IVF, we are always talking about the emotional burden on the female, and how she's been through a social burden and all these things. Trust me, I'm being very blunt and open and honest about it. You talk to a male partner alone, and you will realize that even the male partner has a very huge emotional side. Even the male partner has a very huge social side. it's too much on the male partner as well. It's not just the female partner. So I think that really helps, because since we specialize in that, we do end up counseling a lot of males in private without their female partners, right? Without their wives. And trust me, they open out very nicely, and there has been a J-shaped increase in that. People really want to talk about it. People want to let out their bad emotions,
Hmm.
which they feel regarding it. And I think that
Hmm.
is something which is very good.
No, that is actually quite interesting that we're talking about this also, because we don't sort of, when we talk about the emotional pressure and burden, of not being able
Yeah,
to have a child or fertility issues, we often don't talk about how the burden emotionally is also on men, because traditionally we don't
big
expect
time.
men to talk
Yeah,
about it.
yeah, because males are not expected to cry, right, in public, or males are. It's below dignity to let out your emotional stress
Yeah.
to someone. It's always hidden. For women, it's easy. Maybe they can let it out. Maybe they can cry about it or whatever. Of course, it's not good, but then it's easy for women to let it out. Maybe it's not so easy for men, and I think that is something which is changing very nicely,
Which is quite, frankly speaking, I think that's a big, big change and a long time coming.
which is very, very progressive, which is very good.
Yeah. Absolutely. But so according to you, what are the top three things that couples should consider or keep in mind before deciding to go for IVF?
See, whenever we try to speak like this, I'm going to be speaking of things which are very practical. So when you look at a country like India, one, you should be sure of your finances, right? Because what typically happens is you have a lot of fertility clinics mushrooming across the country. Not everybody who puts up a board of a fertility specialist is actually a fertility specialist, right? So that is one thing. The background research should be done very nicely. Second, I've laid a lot of importance on cost throughout the course of my career, because India is still a developing country, right? So couples usually who are spending treatments for fertility, they are spending from their savings, right? They don't get a reimbursement from this, through a mediclaim or something. And even if they do get, it is not adequate enough. Okay. So couples should be very, very proactive in finding out the exact cost. Why I say the exact cost is, you would have heard or you would have come to know that there are a lot of places where there are a lot of hidden costs. People give
Yeah.
you a budget, or people give you a cost estimate of, let's say, 1 lakh rupees, and your final bill comes to 1,80,000 rupees, right? But if you were told that your bill is going to be 1,80,000 rupees, the couple knows that they
Hmm.
need 2 or 3 attempts at this treatment. So if you tell them 1,80,000, they will provision for 5 lakh rupees, thinking that
Yeah.
they might need the treatment 3 times, right?
Hmm.
But if you tell them the cost is 1 lakh rupees, they will provision for 3 lakh rupees. Okay.
Hmm.
And out of which 50 or 60% of the cost is used up in the first attempt itself, which was a part of the hidden cost, which was never told to them. So I think
Yeah.
the cost is the most important in India, right? Second, as I said, or probably that should be a second point, which I said, that you must find out where you are getting treated from. Don't
Hmm.
don't go to an IVF clinic because the IVF clinic is in your backyard, or the IVF clinic is the closest to your house. You don't do that when you're searching a job, right? You don't say
Hmm.
that I'm going to find a job only in offices which are located in the area where I stay,
Yeah.
or if I'm getting a better prospect to go abroad and work to, let's say Germany, I'll not do that. I'll ask Germany to come to India. I'll not go, right? You don't do that. So then that should not be done for health as well. Okay. And third, I personally believe, okay, you must have at least 2 or 3 opinions before you are doing a fertility treatment, because many a times at many places you will have super specialists who will be able to avoid IVF for you on certain occasions. So if they are able to do that for you, you will save on a lot of cost. All right. So it's very important that couples go through these 3 things before they plan IVF. So to put a simple perspective into this, we
Hmm.
do get couples with azoospermia who are traveling from Kolkata to Bombay. I'm located in Bombay. So for them, it is nearby. Understood? They always come and tell me, "Oh, thank God, sir, we found you. You are in the same country. Okay, and
Hmm.
we are very happy because you specialize in this, and there are just 5 or 2 or 3 people who actually specialize in this."
Hmm.
People will put up a board, but once a treatment fails, no, then they begin to actually hunt down and go down to the basics, and that's when they find you, right? But
Yeah.
but we do have couples, who are trying for the first time, and somebody has convinced them so blindly that no, this is located close to my house, so I'll go and do my treatment there, even if it's a bad center. Because
Yeah.
90% of the couples who fail their first IVF cycle, right? They then end up considering better options. Rather than doing that, they should consider a better option right from the word go. And I think that should be the approach, if you ask me.
No, and also, if you come to think of it, in the past 5 to 6 years, the number of IVF centers have, increased. Once upon a time, IVF was it was a very nuanced conversation. It was a niche conversation, but now you're right. It's everywhere, and it's in the poshest of localities. It's in the poorest of localities. It does then become a matter of, if I can go to, a doctor behind my house for other checkups, then why can't I go to an IVF center behind, my house? Why won't it give the same results? So to that, I
Yeah.
have a question, that how exactly, what would be the tenets of a good IVF center then? Like, how do you choose that this IVF center is good for me?
See, we were just discussing this prior to the show, that we've
Hmm.
we've not done any sort of massive marketing as far as IVF is concerned, but
Yeah.
still, at most of the platforms, people catch hold of us and invite us, right? Now, why does
Hmm.
that happen? Remember, in IVF, no, the answer is very simple, right? What is your result? Your result is a healthy child
Hmm.
which has been born after a year of your treatment. Okay.
Hmm.
So, irrespective of the amount of marketing you do, if you're not able to deliver healthy children after 1 year of treatment, right, your marketing is going to last you for 2 years, and then it's going to go down the drain because you're
Yeah.
not giving enough healthy children, right? People must remember that no matter where you do IVF in India, you do IVF in China, you do it in Japan, you do it in Pakistan, you do it wherever, the average success rate of IVF is going to be around 30 to 35%, right? It's not going to be 80, 90, 100, 200%. The average success rates of IVF across the globe for a standard set of population is going to hover around 30, maybe 35%. Okay. As the age increases, your success rate is going to decrease. You cannot change this. These are unfortunately and undeniable facts of IVF. Okay. So usually a clinic which is good is going to give you this information right from the very beginning of your treatment. Okay. They're going to tell you that your success rate is around 30, 35%. They're going to tell you that you are going to need multiple attempts. A clinic which is predominantly interested in getting you in the, you know, getting you as a client or getting you in the line of treatment is going to probably glorify their success rates. Probably. Okay. They'll tell you that, we have success rates of 80%. They are not lying. Trust me, they are not lying. They have 80% success rates in 1 month, and they are extrapolating it to all the other 11 months, right? If you look at a broad average of over 5 years, what was their success rate? Their success rate was 30%. Because if it
Hmm.
was more, by now they should have been awarded a Nobel Prize for it, right? But they did not get a Nobel Prize for it, or they should have been awarded a Padma Shri or a
Hmm.
Padma Bhushan, but they did
Hmm.
not get it. The,
Hmm.
the fact that did not get it was that probably over a broad period of time, they fell back in the line, and they came in the same averages which the world is moving to, right?
Hmm.
So that is
Hmm.
one thing which is very important, which I believe is very important, which justifies a good clinic, right? Now,
Hmm.
second, I also believe usually, in medical fraternity, non-verbal communication is very important, right? If the doctor is doing fertility practice on his own, like if what happens is, like, I'm the embryologist at my place, or I'm the andrologist at my place. So when I look at someone's sperms, when I look at someone's embryos, I'm going to go out and tell them that, look, this is what I saw, and this is what I feel, and this is what I like, and this is what I don't like, right? You can
Hmm.
have certain clinics where one person is talking to you, the person at the back office is somebody else, the person in the laboratory is a third person, and there's going to be an information mismatch, right? So the couples these days are so intelligent that when they see you, they're going to tell you that, this guy has some knowledge because he's met two people before you, or he's going to meet two people after you, right? So when they end up comparing, they'll get that justification, because you can't really stop the sun from shining. No, I don't think it's possible. Same thing applies in all fields of medicine. Same thing applies in IVF. You can't really stop the good people from doing the good work. And usually, over a long period of time, I think we've been in practice for almost 8 years now, and over a long period of time, what we've seen is people ultimately go to places where there are proven results and there is a proven honesty. There is a track
Hmm.
record of being very honest that, okay, you did not form embryos. I'm so sorry. I apologize, right? You formed embryos and you tried IVF 3 times, but you did not become pregnant. I'm so sorry, right?
Hmm.
Because ultimately you are paying the doctor to make an effort to become pregnant, right? You are not paying your, you're not paying your savings to the doctor to make you pregnant. There is no doctor who can promise a pregnancy.
Yeah.
You're paying to make that honest effort, right? Because that is the only thing which is there in your hands. And I think over a long period of time, people realize that, and it takes time. It takes 3 years, 4 years, whatever. It takes time. I agree to that. But then once that place is cemented, no, it's usually you are unshakable. You can take it that way.
So let's talk a little bit about IVF procedures and
Yeah,
failures in IVF procedures. If let's
yeah.
say a couple comes to you and the IVF procedure fails, would you recommend that they undergo the procedure again for a second or even a third time?
Normally, a couple which has failed IVF at least 2 times will be referred to us. So couples won't come to us or won't be referred to us till they've at least failed 1 or 2 IVF cycles. So one thing, let me please tell you again, as a part of this social awareness program, that in IVF, as I said, 100 people do IVF, 30 are going to become pregnant. So what does that mean? That means the remaining 70 are not going to become pregnant, right? So when you failed an IVF cycle, you are with the majority. So majority of the people who undergo a particular IVF cycle are going to be on the side of failure. It cannot be more clearer than this, right? Now, when we are talking or when we are trying to evaluate or when we are trying to examine a couple who has failed IVF, remember that's where that's where you differentiate yourself from a normal fertility specialist, or a specialist who has just put up a board of fertility outside and is good at sweet talking and all these things, versus somebody who is genuinely a fertility specialist, right? So usually, there are hundreds of things which any doctor would look into, not just me alone. Any doctor would look into it, right? They would try to see what went wrong. They would try to see what were the quality of the embryos. They'll try to see what could have been done, which was probably not done, right? And if you try and give a combination of these things, usually what we see is that even couples who have failed to, let's say, 3 IVF cycles, when they go to a good place, they end up conceiving in the next 2 or 3 cycles, right?
Hmm.
Now, at this point in time, I also want to clarify that this could be a stroke of luck as well, right?
Hmm.
It could just have been that you could have done the 4th IVF cycle with the same guy who did your previous
Hmm.
three, and you would have conceived there. But you wanted a change, and you went to someone else, and that was your 4th IVF cycle, and the guy did the exact same thing, and you conceived, right?
Hmm.
So that is also something which couples should remember, because ultimately, that, as I said, if you remember the golden line, no, 100 on 30, right?
Yeah.
That's never going to change. Even if you do, it's not that you do your 3rd cycle so it becomes 90 on 100. That doesn't happen. In the first cycle it is 30 on 100. In the second cycle it is 30 on 100. In the third cycle it is 30 on 100, and even in your 30th cycle it is 30 on 100, right? So that is something which is important for couples to remember.
Which are the odds, and those odds will not change, I guess, for a
No,
while.
no. And those are odds when you do it at a good place. Like if
Hmm.
you go to a good place, it is 30 on 100. If you go
Hmm.
to a backyard place, as I said, if you go to the clinic in your backyard, this thing is going to be 2 on 100, right?
Yeah.
It's going to be 5 on 100. It's going to be 6 on 100, right?
Hmm.
It's the good places which are going to give you 30 on 100. So,
Hmm.
so that is something which people must be very careful about. And that's the reason why I said that you must consider cost as a very important thing when you're
Yeah.
doing IVF in our country. That was my first point, because
Hmm.
after so many years of doing this thing, we've realized that people are really paying out of their savings, and people don't really have that much amount of financial backup to do these
Hmm.
treatments again and again and again.
True.
And that is just the only unfortunate thing in our country. Nothing else apart from that.
So, sir, is there a way in which couples can evaluate if IVF is the right procedure for them without visiting a doctor?
That's like a Google question, no? Can
But also
do
a
I know
question that
if?
a lot of people would want to know, right? Because they just assume, "Acha,
Yeah,
abhi bacha hua, I need IVF. Let me go to a doctor."
yeah. So uh, I, it's uh, see. Remember one thing, no, Meghna. Google offers you free advice. Okay, right? A doctor. I'll just put my name. Let me just put my name here. I take 3,000 rupees to consult, right? So there is a reason why I take 3,000 rupees for a single consult, and there is a reason why people pay me 3,000 rupees for a single consult, right? Now, I'm not trying to say that Google is wrong, but what I'm trying to tell you is that the information which you have on Google, unfortunately, if you are a non-medical person, or unfortunately if you are not a fertility specialist, right, even if I give you the information, you don't have the algorithm to interpret it. You will interpret it based on some data available from somewhere, right?
Hmm.
When you go to a fertility specialist, this guy or this lady who is a fertility specialist is going to evaluate you based on 100 other things which
Hmm.
unfortunately you don't know,
Hmm.
right? Which you don't know. And if they do tell you, usually what we've seen is over the last 5 years, most of the fertility specialists who are good, they end
Hmm.
up giving you reasons in writing that, this is why I think you need to do IVF, or maybe this is why I think you need to do IVF, right? There will always be a written answer to that. So please
Hmm.
solicit that opinion, right? Don't just say that Google told me to do IVF. So just in case your IVF fails, unfortunately, you're in no capacity to sue Google, right? You're in no capacity to do that. So it's prudent that you are spending 5 lakh rupees or 2 lakh rupees or 1 lakh rupees for a treatment. You might as well have an opinion of a good person, of a person who has been dedicated to this profession. And I'm sure, quite a lot of times it happens to most of the people when people come and tell us, and when we look at the file and they say that, doctor, we have come to you for IVF, and we tell them, but great, I mean, we are very happy that you have come for that, but you don't need that, right? And they are very depressed. They feel very unhappy about it, that no, but I've made all the arrangements for IVF and all these things. And it takes 20 minutes to convince them that you don't need it, right?
Hmm.
And then they are like, no, but then what is the guarantee I'll conceive? And what happens is, unfortunately, in today's world, people want results in the month when you try for treatment. Let's assume you are trying for pregnancy in the month of August. If you don't become pregnant in the month of August when you tried, right, you begin to feel that August is a very bad month. Then again you go to September and you try in September and you realize, and if you don't become pregnant, these days girls used all those stupid uh, ovulation kits and some monitors and some stupid apps which are available and all these things, right? People use that, and the best what they can do is they can give a poor rating to that app, right?
Yeah.
Because they did not become pregnant in the month of August when they tried. But couples fail to realize that when somebody is trying naturally, uh, this is not an exam that you tried in August, अब
Hmm.
तुम फेल हो गया, अब तुम वापस ट्राई नहीं कर सकता. That's not how nature is, right? You
Yeah.
might take 4 to 8 months, sometimes even 12 months to become pregnant naturally.
Hmm.
That's the way nature is. You can't really change the way nature is. And that's very difficult for couples to accept. These days people are very busy. I'm so busy, I have no time to have sex. Oh, great. I mean, then how on earth are you going to become pregnant, right? You have no
Yeah.
time to have sex. So first, please find some time to have sex and then come to a doctor, right? You can't be going to a doctor and saying, you do something, you give me tablets, but I'll not have sex. Now how are you going to become pregnant,
Yeah.
right? So but then that's that, right?
Hmm.
And I think there are two sides to it. See, when couples do this, no, they end up getting so confused that they visit fertility specialists more often, so it increases our business, let's put it that way. Okay. Simultaneously, even if we give them the right opinion, the bad side of this thing is they are so dependent on Google that they don't rely on the doctor's experience. They rely on some blog written by some novice social media influencer on Instagram or Google, and they try 6 months and they spend 6 months wasting their time in that, and they don't
Yeah.
conceive because they were any which was not going to conceive, right?
Hmm. Hmm.
So I
So
think
true. So,
probably that should change. Probably that should change.
so clearly, I mean, the role of a doctor here to at least see a doctor to figure out what should be the next steps for you if you're trying to conceive is of the utmost importance, even if
Yeah,
it's
I
not
mean,
IVF.
I'll make it even more simple for you, right?
Hmm.
I believe you told me many women are going to listen to this, right? So I'm making it even more simplified for you. You want to cut your hair. Do you
Hmm.
Google how to cut your hair, check a video on YouTube, put a mirror behind your thing and start cutting? You don't do that, right? You want to, I believe women like to, let's assume there is a new collection in some good store, right? You don't look at that collection, and you at least go to the store, you go to the trial room and you see if it's fitting you or if it's not fitting you, right?
Hmm.
And only then you spend that money and you buy that cloth or whatever, whatever that is, correct?
Hmm.
So if you are doing this for your clothes, if you are doing this for your hair, if you're doing this for your makeup, if you're doing this for your office, if you're doing this for everything, right, why are you not doing it for your own body?
That's a very valid point to make. Absolutely.
Right? And trust me, the cost of visiting a doctor is 5 times cheaper than the cost of visiting a barber. Come on, I mean, you will agree to this. So so I don't know why, but probably it's a social inhibition, or I don't know how to put it, but then unfortunately that's how it is.
But that could also be because in India, just generally gynecologists, you only go to a gynecologist when you're pregnant. We don't have the practice of going to a woman going to a gynecologist because it's good to, get a hold on what's happening to her body, what's happening to her reproductive side. That's also
So
a big
so
mindset.
yeah, but that's because predominantly the mindset is that we are not bothered about our health as such. If you look
Hmm.
at Indians,
Yeah.
or I mean, I don't want to fantasize or put a word onto it, but as such, if
Hmm.
you look, health
Hmm.
is not the top three priority of an Indian family, right? In an Indian family, predominantly the priority is maybe getting a good education, or eating probably good food, or having a good vacation, or multiple things. But if you look at that, health is not going to feature in the top five, unlike
Hmm.
most other countries. So if you start featuring health in top five, see, I'll put another analogy to this, right? There are people who spend unbelievable amount of money on trying all these, some naturopathic therapies and online yoga classes, all of those, right? That's great. It's so good that people are doing that, right? But if you're spending so much money for something which is going to be so slow in acting, so yoga is not going to give you an immediate result on back pain the first time you do yoga. It's going to give you a
Yeah.
sustained effect after 6 months, right?
Hmm.
That's okay because it is yoga, right? Then why is it not okay to go a doctor once?
It's a mindset. You're right. It's a
it,
mindset.
it,
Hopefully,
it's
yeah.
it's taught in school, right? You are never told in school that, oh, you
Hmm.
you have cough. What are you taught in school? Take steam inhalation, right? What are you taught? What does your school teacher tell your parent when your child has a bad throat? Oh, he has a bad throat, give him something, haldi ka doodh pila do yaar. Because everybody is a doctor in self treating,
Yeah.
right? And that is the reason why that mindset percolates,
Hmm.
and that happens, and that's why the delay happens. See,
Hmm.
couples unfortunately don't realize that they end up delaying their treatment by not doing the treatment on time. And when they delay their treatment, they are reducing their own chances of
Yeah.
becoming pregnant. They are not reducing the doctor's chances of becoming pregnant. Most probably the doctor already has children, right? They are
Hmm.
reducing their own chances of becoming pregnant.
So yeah, so if you, let's say, don't go to a specialist or even to a doctor to figure out what's happening, the more you wait, the more you, for lack of better word, waste the time, the lesser the
Yeah,
chances of you getting pregnant. So the 30 per out of 100 odd becomes even lower, right?
25, then it becomes 20, then it becomes 10.
Yeah. So in your career as a specialist, what are some of the most challenging cases that you've come across? If you could share that with us, and some learnings from it for our audience.
See, I told you that this is the third time in this week that I'm doing something like this,
Yeah.
and
Yeah.
and everyone has asked this question that please share the something which was very challenging. So I'll tell you what is very challenging. You know what is challenging is to do a treatment for somebody who is absolutely normal, right?
Hmm.
That is something called as unexplained infertility. Like, let's say if I tell you sperm count is less, or let's say if
Hmm.
I tell you your uterus is not good, right? You can easily accept it. Yeah, I have reports, and I did the reports from a laboratory and everything is showing it's not good, so the doctor is maybe right, correct? So you will go and do the treatment because it's falling in sync with what you think about it. Correct? Now what happens is approximately 30% of the couples across the country, across India, are people with unexplained infertility. The word itself says that there is no explanation, right? Because it is unexplained infertility, right? Now in this, husband's reports are normal, wife is normal, wife's periods are normal, wife's reports are normal, wife's tubes, every damn thing you look at, no, is normal, right? Treating a normal patient is the worst thing to do, or it's the most difficult thing to do, because no matter what you tell them, it just takes one other person to go and tell them, अरे पर तेरा तो सब normal है, क्या पागल डॉक्टर है, क्या ट्रीटमेंट का जरूरत है, right? In fact, unexplained infertility couples require aggressive treatment. These are the guys who need to be treated very aggressively. And it's very difficult to convince them, because if you tell them, the first question they'll ask you, but doctor, problem क्या है? Right? And your answer is, मेरे को मालूम नहीं यार, problem क्या है मेरे को मालूम नहीं, सब report normal है. तेरा definition आता है unexplained infertility. They'll stare at you. Arey, I paid you 3,000 rupees and you are telling me you don't have an explanation for this thing, right? Find something. Unfortunately, the number of tests which we have are limited. We have only 4 or 5 tests in fertility. And unfortunately, the number of factors which contribute to pregnancy are 50. And you have tests only for 5. So I can say, अरे वो जो 45 जो untested है ना, उसमें कुछ प्रॉब्लम है, एंड दे कैन से वो प्रॉब्लम है तो वो नॉर्मल भी तो हो सकता है, राइट? आप बोल रहे हो एबनॉर्मल हो, मैं बोल रहा हूँ नॉर्मल हो, सो वी डोंट नो हु इज राइट इन दैट, करेक्ट? So if you ask me which is the most difficult patient to treat, the most difficult patient to treat is a patient with unexplained infertility, whose reports are normal. Now, unfortunately, these couples need aggressive treatment. And unfortunately, these couples get easily swayed away, you know. If you tell them, अरे तेरा रिपोर्ट नॉर्मल है, as I told you, तेरा रिपोर्ट नॉर्मल है, वो डॉक्टर उसको पैसे का बहुत वो है, वो डॉक्टर गलत डॉक्टर, you know, they'll change, they'll switch the doctor. Now the other doctor tries something, it's not going to help them because they need aggressive treatment. They tried 8 months, it did not work, they wasted 8 months, right? But had they done IVF at that point in time, it would have been easy. So if you ask me what is difficult, it's difficult to treat people who are normal. It's very, very difficult to do that. Very difficult.
This is actually quite interesting because whenever we've asked this question, we've gotten plethora of answers, and usually cases in which, like, let's say there were women over 40, couples who've been trying for years. But it's so unique to see a perspective like this, because we often, we've heard about the fact that there's this whole phenomena of unexplained, infertility, but we don't often hear about, if that happens, then what are your course of action and what your doctor is likely to suggest. Because like you said, if सब कुछ normal है तो pregnancy भी तो naturally हो सकता है ना, then why do I even need to go to a doctor? Then that mindset comes into play.
Yeah. And that's, trust me, it's very challenging. Like if you tell me, doctor, if I tell you, do one thing, Meghna, you are so busy, let's do one thing, start taking daily paracetamol so that you don't get headache, right? And you will tell me, but I'm not having headache, right? Why should I take a tablet when I'm not having the headache? But I'm telling you, no, you take it so that you don't get it, right? You're going to keep the phone down and you're going to say, kya bakwas karta hai? Next time I'm not going to consult this guy.
Yeah.
He doesn't know anything. It's so simple to say he doesn't know anything. Pagal hai, right? And that's a common mindset. And that's what very commonly happens with patients with unexplained infertility. Very common, very common.
So, complications in an IVF pregnancy can often arise out of a lack of awareness, in which we've understood over the course of this series is that there is a lack of awareness. There are a lot of myths out there.
Yeah,
so
huge.
What would your advice be to women who are undergoing this procedure?
See, any pregnancy, as such, first of all, people must realize that pregnancy is not a disease, correct? Pregnancy is a natural state of the female body, right? It is not a disease. Second, don't try to equate an IVF pregnancy with a disease, because even an IVF pregnancy is a pregnancy. So it is not a disease, correct? Again, when you are getting treated for a pregnancy post IVF, it should be your effort that you go to a good obstetrician, a good guy or a good lady who knows how to handle these things, because as you asked, the number of complications which may arise, it's not that they will arise, which may arise, need that little quick action. at times. You can't have delayed action. I'm not saying that when you conceive naturally, you can have a delayed action. I'm not saying that. But quite a lot of times, people who do become pregnant post IVF, they've gone through a lot of period of infertility before
Yeah.
they've conceived, right? So they are extremely attached to that ongoing pregnancy. And you need that type of expert care to do quick things when you have an IVF pregnancy. And I think that is very important. Unfortunately, again, the problem is not with the patients in this. The problem is most of the fertility clinics don't want to handle pregnant patients. 90, if you survey, let's say 1,000 fertility clinics in India, I believe by now there'll be 1,000. Okay. If you survey 1,000 fertility clinics in India, out of that, maybe 980 will not be handling their own pregnant patients. Only 20 will be handling. Okay. So what happens is, because they don't handle the patient is lost. The patient is like, okay, I'll go to anyone. The doctor said everything is okay. And that normal guy whom you go to, he or she doesn't do IVF, right? So they don't have an experience in order to handle that. And I think that should be addressed by the patients, by the fertility practitioners, by everyone. It will make a huge difference in patient outcomes. Huge difference.
But that's so interesting, because I was always under the impression that if, let's say, you go to an IVF center and you get pregnant there, then from that point to the time you deliver, it's that doctor, the IVF doctor, who's like there, who's in charge
20
and
on
who's
a
the journey.
20 on 1,000. 20 on 1,000. So that success rate of finding a fertility specialist who is your obstetrician is going to be
Yeah.
0.2%.
Because that would, likely be a big shock for the couple, right? Because now they've put their trust in this one person. Now they need to find another one all over again.
Yeah, it's common, but it happens very commonly.
Okay. So, sir, we are coming to a close on our session, but before we call it a day, what would your last words be to the audiences here? What would your ultimate golden tips be when it comes to IVF success and failure to the people listening in?
See, I think I'll just summarize it very quickly, right? The first thing which is important is the clinic in your back door is probably not the best clinic in the country. Okay. Just because it is close to your house does not mean it should become close to your heart, right? That is something which you should remember. Second, a good IVF specialist should be able to give you a success rate of around 30 to 35%. And unfortunately, that is the global normal, right? So even if you want to become pregnant in the first attempt, as desperate as you are to get pregnant, you must realize that the majority of the couples, at least 60 to 70% of the couples, are not going to conceive, right? And that is, you can put the blame on nature, because there are so many things in this science which, as normal human beings or as doctors, we are not aware of, that we don't know how to improvise on them, right? And that is the reason why it is a science in tremendous research. There is huge amount of money being spent on research on this, because there are so many loopholes to this which people are not aware of, correct? Now, and apart from that, you must always realize that, for heaven's sake, if you got to do a treatment, please do your treatment on time, right?
Yeah.
Because this is an age dependent process. You can't say that I'm 35 but I'm extremely busy, I have no time to go to a doctor, I'm going to go to a doctor when I'm 38. If you are putting up such statements, you must also be willing to accept that at 35 your success rate is 30%. When you are 38, your success rate is going to drop down to 20%. So if you're willing to take that 10% hit, right,
Yeah.
you can spend some extra time doing whatever time pass you want to do. But once a treatment is indicated, it's indicated. It's so simple, right? I always tell this when I conclude. When you are traveling and you meet with an accident, and let's assume you break your hand, correct? You don't spend any time getting mentally ready. No, you don't spend any time asking your mummy, asking your papa, asking your family, asking this, asking your friends, googling anything. What do? You go to a doctor and you tell them कि यार मेरे को बहुत दुख रहा है, please put a plaster if plaster is necessary. You tell this, no?
Yeah.
Right? You tell this for your bone, correct? Now that bone is going to get healed very easily. Once you put a plaster, within 4 to 6 weeks you are back to normal. Fertility is something which fractures your emotions. Fertility is something which fractures your finances. Fertility is something which fractures your social life, right? If it is fracturing all these three things, why on earth are you taking so much time to take the right decision?
That's very poignant thought.
Yeah, why are people taking so much time to take the right decision? When it is
Yeah.
fracturing everything else, you're taking so much time, right? When an inconsequential bone gets fractured, toe gets fractured, thumb gets fractured, you go to a doctor and you will immediately get it plastered. Why is it like that? Why is it like that? So that is something which people must ponder about, right? And when they keep on pondering about this on their own, when they introspect on this, I believe they will have much more thoughtful answers to this, and hopefully that will enable them in giving themselves a good shot at fertility, right?
Absolutely. I think that's a very beautiful note to end this session on. Thank you so much for giving us your time and your insights today. It has been an absolute pleasure.
Thank you so much.
Have a nice day.
Bye bye.